Many people, when they hear the word trauma, go, well, I haven't experienced trauma in my life. I haven't experienced anything like some of these other situations that are really severe trauma. But trauma is something that each one of us have experienced in our lives. And unresolved trauma lays the foundation for addiction. And so a lot of the work that we're doing in recovery now is focusing on the core issues. And unless we get down to some of the core issues, the long-term results, people tend to get frozen and stuck in their trauma. So we've got to address trauma. And probably the most significant research data that has ever come about as it relates to trauma and how early childhood experiences truly affect us is called the ACE study. The ACE study stands for Adverse Childhood Experiences, and it was a collaboration between the Center of Disease Control and Kaiser Permanente Hospital out in San Diego, California. And so they followed a cohort of people, of 18,000 people for a period of 10 years. And they asked them a series of 10 questions that did they experience any of these things prior to the age of 18? And directly related to how an individual responded to these 10 questions, like, for example, was there recurrent physical abuse when you were growing up, emotional abuse, contact sexual abuse? Was there an alcohol or drug abuser in the household? Was a household member incarcerated? Was there a family member who was chronically depressed, mentally ill, institutionalized, or suicidal? Was your mother treated violently? Did you have one or no parents? Was there physical neglect, emotional neglect? So as a person would answer these 10 questions, they would get a score. So if I answered 3 of those in the affirmative, my ACE score would be 3 or 4, and so forth. But here is what really astounded the researchers, that in direct correlation to how an individual answered these questions was exactly, well, it was exactly correlated that individuals would struggle with the following issues: alcoholism or abuse in their own lives, chronic obstructive pulmonary disease, depression, liver disease, suicide attempts, adolescent pregnancy, early initiation of smoking, risk for intimate partner violence, fetal death, or illicit drug use. So again, directly related to what the ACE score was the likelihood that an individual would deal with any of these issues. And some of them, as you notice, are in the body. So back to that, the research done by Bessel van der Kolk, the body keeps the score. The body really does keep the score of our lives. And so we know clearly that what we experience growing up leaves an impact on us. And so being able to identify some of those things and work through them is the appropriate course to moving forward. And if you feel like you really need to, that therapy would help with a licensed therapist to work through some of those things, that would be an appropriate thing for you to look into to get the needed help to work through some of those childhood issues. But this program will at least lay the foundation to help you identify what they are if you go through the assignments in the workbook. So some might, again, want to minimize their trauma, but I want to really help you and encourage you to pay attention to some of the experiences that you've had in life and give them their due and pay attention to them. Because we don't know what happens inside each person individually, but as we look into our lives and even do the moral inventory, as you continue, to think about that, maybe some of those traumatic experiences will pop up in your life, but they're critical to be able to identify so that you can do the work necessary so that you can put them at rest. And the work necessary can take place in counseling. There's a specific form of counseling that's really effective for traumatic events and PTSD. It's called EMDR, stands for eye movement desensitization and reprocessing. It's one of the newer forms of therapy, and it's now considered a best practice, and it's very, very effective. So everybody experiences trauma in to one extent or another. In trauma, the research, what is indicated lately is that Bessel van der Kolk uses the term it frozen. Your brain gets frozen, your body gets frozen, and then a part of it always just stays shut down. And so it can definitely lay the foundation for addiction because you're in a constant state of stress. See, the problem with trauma is that long after the actual event has occurred, it's like the bear is still there. Like if you were to see a bear in the wild, which I had the experience of once also, not a fun experience when it's 10, 15 feet away from you. And you know it can do whatever it wants to do. Adrenaline starts flowing, cortisol starts throwing certain survival neurotransmitters in the system. But when the bear leaves, then those neurotransmitters go away because you're not in fight or flight anymore. But with unresolved trauma, what happens is your body keeps registering or sending those chemicals throughout the body as if you're always in danger, and that wears the body down, and so you can't recuperate. And many survivors of trauma, especially sexual trauma, aren't doing very well in their bodies because their bodies don't have the chance to fully recover and heal through relaxation. And that's why a lot of the stuff we teach is mindfulness, awareness, things like that, meditation, to try to calm the body down so that it can heal itself naturally. But when we're in a constant state of stress or frozen, which unresolved trauma can create, the body never has a chance to do its thing. And that's why so many survivors that I've worked with, they're just not doing well in their bodies. And so that's why what we do is to get them focusing on working with their bodies at the outset, along with talk therapy. But talk therapy alone just doesn't seem to do it. You got to get their bodies engaged in things like yoga or martial arts and stuff. And we've seen tremendous results with individuals who do that.